Okay, good afternoon, everyone. Um, I have set the deadline for the midterm today for the first batch. For the second batch, because I would just like to check the pace of on the progress of your compliance of your requirements. So, as I set the schedule now, I cannot actually move it anymore. However, I can just consider a second batch of submission, and I'll be flexible for the date where the ethics board give you the schedule that you can have back. I mean the clearance. So with that, I really need to know the progress of your paper so that I would be able to discuss. I could be guided on the topics that I will be discussing. So even if you are not yet done with, or even the submission or the clearance is not yet released, I still want to know, since um, my purpose of that consultation is first and foremost is to monitor the progress in the compliance of your requirements. The second is so that I would be, if you already have the clearance and the revisions, the suggestions coming from the board, I could give you some advice, assistance, and suggestions on the possible, shall we say, on the possible compliance or whatever requirements asked by the ethics board. Then finally, I have, you need my e-signature. So I could only give the signature, my e-signature, for example, the consultation of faculty, subject consultation between the faculty, between me and you, if you have some group concerns. So with that, I can readily give you my signature because I know that it's okay. It's okay if I'm going to give my e-signature. So I have observed that there are several groups uh, who who did not care to schedule for consultation. The reasons, one of the reasons may be that you were already having a consultation with your advisor. That is advisor advisee consultation, but that is not the consultation that I would like you to submit. Though that is one of the attachments, the advisor advisee consultation, that is one of the attachments. The midterm requirements would already, I would let you submit the clearance coming from the ethics board and the consultation form. Now the consultation form for that consultation form, it's composed of the consultation form of the subject, the consultation of advisor and advisee, and the attachment. The consultation of advisor and advisee would be, or I would require that as an attachment. And there would also have a proceedings. The proceedings when I have that subject consultation with you. The proceedings such as where we have, or the minutes during the consultation, whatever proceedings, whatever discussion I have, whatever suggestions I provide, whatever assistance I have provided because you need it. So you are going to write that in the proceeding. or part of the consultation, minutes of consultation. So you were asking, I cannot just, shall we say, I cannot just give my response individual kay I would be repeating my sani whatever questions you ask. What about I may sound like a broken record, so it would be appropriate if we will just meet here in our Google Classroom. So that's why I mean those who inquire, I told you to ask those groups that were done with the consultation. So again, I would repeat that the consultation deadline, I mean the midterm requirements is set today for the first batch. For the second batch, after the consultation. So if I mean I'll be considering the release now of the clearance, so that you will not be giving further excuses that you have not received the clearance yet. So I can only consider that second submission. However, it would be different in terms of rating. Since there are already groups that were done, that have submitted the requirements for prelim and midterm. Okay. Now, it would also be unfair that others started very early, and then uh, when the deadline for when this deadline is required for you, you will just say that I am not yet done. So what takes you longer in the compliance of that requirement, when in fact the other groups were able to comply. So just to be fair with other groups, we're able to have a clearance, although especially for experimental, they have other clearance to ask, but that would be enough for me as of this moment to have the clearance from the ethics board, since not all of you would be having the reliability test. That may be a reason why it took you some time to submit your requirements to the ethics board. So as I've said, I can weigh things, provided I can only check the progress of your requirement, and I can only make considerations if you have consulted me. There were several consultations. Prior to this, there were groups that were having several consultations. As an advisor, as your faculty of the subject, it's my responsibility. It's actually my responsibility to guide you, to give you suggestions, to give you insight, that you will be guided on where to go. So, for example, I will have to change this doc for the questions like that. So, it would, it would only cause a delay in your work, since the panel of evaluators cannot just give you the approval. We need to consult with each other whether there is a need to change your questions. And other than that, there are the faculty or the panel of evaluators are external, and they also have other works or job as a part-time. So that's why you have to, from time to time, you have to really make a follow-up with me or to your advisor. But anyway, as I've said, you would be given a second chance of submission. That is, if the clearance, if the ethics board would give you that clearance. So just tell me, require the leader to PM me if your when will be the clearance in the from the ethics board would be released, so that I can give a second consideration of your submission. That is, I am not the one requiring the submission, but also your laboratory faculty, laboratory teacher also require the submission of those that I have required from you. So that's it, no? And then I would also like to give some feedback based, I mean, based from that consultation, I would be able to give suggestions or assistance based from the FREBS or based from the ethics board's suggestions. In some of the paper, in some of the manuscript or the ethical form, there were suggestions coming from the ethics from the board. Like for example, how would you write? You should complete the ethical consideration. There are terms that needs to be or that need to really be expound, or you have to clarify the for example, conflict of interest. How are you going to write the conflict interest? You know how to write the conflict interest. That's a reason why it has been returned to you, because it's lacking. There are lacking items that should be present in the ethics board. I I have a previous engagement in checking or in reviewing the a manuscript, because I was also a reviewer. I was a reviewer of the ethical and the technical paper. So I know very well, since the ethical considerations national, it is mandated from a national was this from a national or a standard, a uniform standard, a national standard. So I am familiar. I was oriented on how to fill out those items that needs to be emphasized. Now, some of you would just place there, like the risk. How would you describe the risk when you conduct the paper? Some of you, the risk that you have described or are not concerned, or it's for the the procedure. It's funny the procedure. Yeah, true. But the risk, one of the emphasis of the risk should be the protection of the researchers. How would you protect from that risk? Is it or has it is because there is risk and benefits. Are the benefits outweigh the risk? How are you going to reduce? How would you minimize the risk? Example, safety protocol. You are facing the uh, microorganism, and there are microorganisms that would, once you are exposed to microorganism, especially microorganism is contagious or what shall we say, virulent, or would cause some infection. So how would you protect yourself from that? So that is one of the risks, not only the procedure, but the outcome. Some of you would emphasize or would say or discuss the outcomes. There would have, you might afraid that there would have some risk in the outcome of your study. For example, it's not, it doesn't, it would not give a result, positive result. Yeah, it could be, but what is really emphasized there is when you conduct the experiment, what safety protocols are you observing, or are you having from any harm, conflict of interest. That is also one of the items. What is that conflict of interest? Some of you would just say there's no conflict of interest, and then you will really you will base when you have when the time or when we mention of authorship in terms of authorship, uh, would it be a conflict of interest? Okay, would it be a conflict of interest? Like for example, authorship, ownership. You are might have some co-authors, and you have a consent to that. And that is one of the protocol of the ethics board. And also in terms of ownership, it's the owner. It's once you have that output, since that is a requirement of your program, it belongs to the school. Is it becomes the property of the school. Though you are the author, you are still recognized, but the property of that paper belongs to your school, and you should be aware of that. You can never tell that in the future your discovery, your inventions that you have, um, makes money, no, or that would be, shall we say, that could give you a financial gain. So, of course, you really have to claim for that. So, it would be emphasized in the ethical consideration. So, that is one of the emphasis you try to ask your the ethics board in terms of conflict of interest. Since the conflict of interest has something to do with ownership and authorship. And then items like there are um, I would show you what are those ethical consideration. I think you are provided with the forms with the ethical consideration. Just don't know why you have not expound it and uh, write it as part of the ethical consideration. There were there were words or terms that were asked by the ethical board for you to include that in the ethical consideration. Now, they would also look into the technical aspect of your paper because what is not technical is not ethical. Like, for example, the format of your paper, the way you structure your paper, like the way you present your methodology, if it's not in institutional form, very sensitive to it since it would make you non-compliant. Okay, so papers like who 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 click the koan recording. Does anyone click the recording? Is there an automatic recording here? I think no. Okay, more options. Okay. So, like for example, your research design. I have also read in your research design. What is in your research design? For example, there are several types of experimental research design. You have to be specific with your research design. There are research design that is experimental, pre-test, post-test. The type is could be true experimental, pseudo experimental, or pre-test, post-test experimental. The pre-test, post-test is most still experimental, but especially for descriptive, quantitative. You have experimental in descriptive, quantitative, pre-test and post-test. Shall we say, for example, the performance of the school or the academic performance of the students. Pre-test, you are going to make some sampling using the pre-test and post-test. For example, in pre-test, it's there. You just give the exam to evaluate the competency of the students or a certain respondents. So after that, you need to, you see the performance. Then after checking or evaluating the performance, if it is really very good, you have to apply techniques or give the exam again. From there, you can compare the difference before exam or pre-test before the intervention, no, before the intervention of some techniques or strategies of teaching. So in the design, in your research design, that is pre-test, post-test, experimental, and you are using since you will be comparing two variables during for pre-test and post-test, then you have to use or you can use the t-test. Okay, if two variables, if multivariate analysis two or more variables, then you can use nova or chi-square, uh, four variables or six variables. If you're using the nova, you have to use also the ad hoc so that you can check on the in between results of the variables. So that is for true, pre-test, post-test. For true experimental, usually we will use also two or more variables. Now there are specific types of uh, experimental, that is when you use the what's this? If you will be using the laboratory lab, wet lab testing. Okay. If you will be conducting, you will be using, shall we say, testing organism. No, you'll be using testing organism. But I think we have no testing organism here. You did not use testing organism. So you could use Solomon for group design. Okay? This is a type of experiment where participants get randomly arranged to either one of four groups and so on and so forth. So call as the the two group variable design, where you just use the pre-test and post-test. Or pseudo experimental. You are not using the testing organism. You are not having a random sampling on a testing organism. Now, if it is a true experimental, what are the requirements for true experimental design? It must be it must have a manipulation of variables should be manipulated. That a requirement for true experimental design. This should be an establishment of cause and effect relationship between variables. And also, you would also be manipulating the variables random. There is a control group, the also random assignment. Random assignment, meaning participants are randomly distributed within the groups. Okay? So you could have first group, second group, third group. That is for group Solomon design. Na-assign two groups, no? Two groups design. So again, there should have a control group. There should have a variables, independent, independent, random assignment. That is for experimental design. But if you're not using, shall we say, some of you are just getting the observance. You will, you want to know the observance level. You will compare the observance level. So you could compare that. You can use the t-test for that. So it depends on what are your variables. Before I discuss on the congruency of your title, of your problem or sub-problem, or title, the conceptual framework, critical framework, then the problem, sub-problem, then the design, then the research design, then the analysis of data. So there should have a congruency on these components to provide or to have uh, a positive result, positive findings of your hypothesis for experimental. Or it could be correlational. You are going to establish the relation of variables on demographic profile and the performance level. So you would be checking, or you'll be using the person R. If that is significant relationship, you will use person R for correlation. There are two types of test, correlation and significant difference. If it is correlation, significant relationship, you will use the person R. If it is for significant difference, you'll be comparing the significant difference, you'll be using t-test. And there are other statistical tools that can be used. Then you would also be using some descriptive statistics. Okay, so today I'll be presenting you our syllabus, uh, what we need to discuss. So that is for the requirements of your midterm requirements. Uh, the technicality of your paper and the ethical consideration of your paper. As I've said again and again, I would say what makes it ethical is to have an appropriate technical presentation of your paper. What is not technical is not ethical. Okay, so do you have clarification now for your requirements, for your midterm requirements? Your midterm requirements, I only need the clearance from the FREB and also the what's this? The clearance and consultation. Then collating your prelim, I will give a midterm exam. I will give your midterm exam based from the requirements and what on other topics that is part of the midterm. Okay, so the those who are not able to have a consultation, I have scheduled tomorrow. I mean, Monday. So that is, I would just like to inform everybody that that is the second chance of having a consultation with me. After that, I will no longer give extension of consultation. Regardless if your paper is complete or not, you have to consult it with me. Okay? As I've said, one of the objectives of having that consultation so that I would be able to, shall we say, would be able to as your advisor, as your teacher, an advisor at the same time, I would be grading you. Aside from the panel of evaluators, I also have to check the compliance because I will be the one to make who will make your grades. Okay. What is the practice in your university? Is lecture and laboratory fused? The grade is fused. Lecture for lecture and lab. Okay. So that's it. That's why I also have to monitor the progress of your paper. What grade uh, I can rate you if I do not know the progress of your paper. And that's the important thing why I should have, even if you have consulted with your advisor, that's different because that is consultation between advisor and advisee. My concern is my subject, the progress of your subject. We have to work. I have to work with a laboratory teacher simultaneously. So if if you will not be monitored in my subject, you cannot really comply on time. If no one pushes you to do that because you are not there was no, I mean, there's no monitoring. You can just have your own decision of what to do with your paper, and that makes it sad. My attention was called by Michali because of the delayed in the submission of your requirements. She told me that you will be given an INC grades for prelim and midterm. So I need to decide for myself whether I will give you INC or not. So how can I give that rating if I do not know the progress of your paper? So it's the only way where I can keep track on the progress of your paper. I do hope you you will not misunderstood my objectives. You might say, it's okay because we already have. She is not our advisor. Why we should consult her? Why we should consult him or whatsoever? Why I need to consult? Why I need to consult Ma'am Yaon? I already have consulted with my advisor. True, because the advisor has a responsibility to monitor to give advices on your paper. But as a teacher, I should know your progress. I should know what are your concerns so that I can provide assistance also, not just your advisor. You might say, our teacher did not discuss that, not know how to do that because um, we have no discussion on the topic. So that would go back to me. I would be questioned because I did not teach you on how to make Like, for example, the presentation of your table, the presentation of data, the interpretation and analysis of data. Okay? So, though you have the guide, you were given a template, but it's not easy to just look at the templates. You don't know how to do that. You don't know the process, you don't know the procedure. There are actually in between lines of those guidelines that you need to ask from me as your teacher of research too. Hope um, you understand the objectives or the purpose. Uh, the way I assess the response of that request for consultation, some are hesitants or some were hesitants to have a consultation. I said to myself, they're already expert. Why should I give time to them? That consultation is not part of my teaching hour. That's beyond my teaching hour. But I insist to offer that supposedly free time for me because I would like to be guided in knowing your paper. So that's why I was I was also hesitant to require you to do the consultation because you're not willing to have that consultation. I should offer my service when you won't like it? But my conscience would not. My conscience states that I really have to guide you in doing your research. I know that some of you knows how to do the process of research. But even if you know already, there are there are things that you need to clarify. As an expert in research, I know what the panel of evaluators would ask from you. That makes you an advantage. You have an advantage to that. If I can guide you on what specific procedure you are going to do, because that procedure is the same procedure that a panel of evaluators would ask during the final defense. So at least I have given you my time to assist you on whatever you want to do. Okay, so much for that. I am going to share you the portion of our syllabus that you need to know. Do you have questions so far? Have I clarified myself? Uh, have I answered? So if those who keep on asking me about the consultation and then not have not consulted me yet, I cannot give you the answer yet. I will not give you that answer because I will be discussing that requirement during the consultation. So that's it. That's why some I would just say, okay, you refer to your classmates. It's really it's, shall we say, I might say tough. I might be tough on that, considering that you are many and different groups would ask the same questions. Can you just imagine the same questions are asked? My time is consumed on answering that the same questions or the same question. That's why in the consultation, I discuss that per group because you have different concerns. Anak lang dyan. So I also have other works other than this research. I also have other subjects other than this research. So that's why I also have my own time. So if I setting that date, meaning in a way it would not that too long. You spare a few minutes lang yun, not even 30 minutes. 15 minutes, you cannot have it. You cannot spare even just for 15 minutes. So that's why I would not be answering anymore regarding the consultation because that would be discussed during our consultation time. If again you insist, you ask your classmates who are done in the consultation because I have discussed there. So I will present the syllabus for your next activity. Allow me to present. Uh, Tell me if it's can it be seen now? Is it clear? Okay. Do you have it now? Can you see? So this is your syllabus for your research 2. It's actually composed of research 1 and research 2. You have there online examinations, modular exam 20%, periodic exam 20%. The periodic that refers to your midterm, prelim, midterms, and finals, so that is 20%. Total quizzes, short quiz, long quizzes, 20%, class participation 10%, and class attendance 10%. For short quizzes and long quizzes, it's where I will get your participation, the requirements. So it's in the class part, the 50% short quiz, long quiz, and class participation. I'll be checking on your activity, the manuscript chapters 1 to 3, the compliance with requirements, uh, for periodical, the prelim and midterm requirements, that is for your periodical exam. So you need really to submit the requirements because I will be basing the scores there. I am for lecture and uh, laboratory is for Michali. Okay, so this is the unit of instruction, Unit 1, the research protocol and its implementation. I think you have this already, no? Okay. So you have there the student learning outcomes, the contents. Man naman is sa research 1 man the protocol, okay? Research protocol topics for integration, the review of the literature, the research protocol. You have this already. Then you have some laboratory activities. Then the unit 2 is the presentation, analysis, and interpretation of research data. The student learning outcomes, presenting, analyzing, and interpreting the results of the research conducted, the collections of data, and also the performing statistical analysis and interpretation of the data gathered. The contents here includes the presentation, analysis, and interpretation of data, um, implication, discussion, and literature support. Then displaying results in graphical, textual, and tabular presentation. So in teaching learning activities, the school-based learning, teacher tasks, discussion of the appropriate presentation and interpretation of resulted data based on the university format. Then for learner tasks, conceptualize new learnings to critically analyze the data collected for the statistical treatment by the statistician. Then that is for performing statistical analysis, presenting, analyzing, interpreting the data. Synchronous discussion of the appropriate presentation and interpretation, learner's task. Okay, conceptualization, a new, this is for home base, new learnings to critically analyze the data collected and so on and so forth. Okay, so resources, call-based learning, classroom, audiovisual, presentation, online resources, laptops, smartphones, and so on and so forth. Then home-based, classroom, Google Meet, Google Docs, and so on and so forth. No? Then assessment, school-based learning, edited revised manuscript based on the colloquium proceedings, written reports, written synthesis, edited revised manuscript based on the colloquium proceedings, and so on and so forth. In the first, in your next chapter is the presentation, analysis, and interpretation of data. Okay, how are you going to do the presentation of data? How are you going to do the analysis of data? And how would you interpret the data? Then there is an implication, discussion, and literature support. Then you will have to display the results in graphical, textual, and tabular presentation. That is the methods of presenting your data in graphical, textual, and tabular. For graphical, you will, like the demographic, you can have a graphical presentation, demographic profile. In tabular or textual, if your study is qualitative, you can use a narrative uh, discussion, narrative presentation of your data, textual. And tabular, you can have, you can place your result in a table in a tabular form. Okay, so these are the means of presenting the data, the methods of presenting the data: tabular, textual, and graphical. Now, what you will do for this as additional task, what you will do for learners task, how are you going to conceptualize this activity or this chapter 4? If you are done collecting your data, because the next is already collecting or gathering your data for descriptive or survey, you will distribute your instrument to the respondents, applying the chapter 3. Chapter 3 is conducting your gathering your data. Chapter 3, you will you have there the reliability test, so you will be given clearance. Okay, the Cronbach alpha result of your reliability test is okay. That is for your chapter 3. You will have the research design. You might be using the research design. You might have the experimental, descriptive, to experimental or pseudo experimental, pre-test, post-test. You can use that as your research design. When you discuss the research design, I mean, in the research design, you really have to explain what is that research design. If your research design is through experimental design, you describe what is that experimental design. You quote from other authors the definition of that research design, specific research design. If it is through experimental, okay, define what is through experimental design according to, shall we say, according to a certain author. And then you provide the requirements. You would discuss further. My study is experimental, is through experimental research design. Because of the following requirement, you will provide the requirements of that experimental design. Then relate it to your study. Example, you are manipulating the variables. You have the independent variables. So which variable is independent and which variable is dependent? You are comparing that variable. That's why it is a true experimental design. You are manipulating your variable. You have independent. You have shall we say, random selection of your uh, subject and so on. That is in the research design. Now, after you can have the clearance, you proceed. That is notice to proceed, meaning you can proceed to conduct your chapter 3. Your chapter 3 was, when it was proposed, it was just uh, a proposal yet. So you have to ask clearance in the conduction of that study. So that chapter 3 is not yet done. You will start there. Especially in the data gathering procedure, you will review the sampling technique, you will review the population of your respondents, you would review the, shall we say, the reliability test. So, okay, the product alpha, it has a really, it's valid, it has been validated by an expert, content expert. The reliability tests are good, has a good result, uh, zero point 0.7 above the range for a good result instrument item. Then, after checking on the validity of your instrument, after calculating your population, your respondents, you would know, you would be guided on the sampling technique. How are you going to sample? So you have to review what is in your chapter 3, because that is the portion where you're going to conduct your study, whether regardless of what type of research design. Then after that, after checking on the instrument, the validation, reliability, the respondents, the population, you control the sample size, okay? Or if it is experimental, you have to refer to the protocol in the experimental also. If, for example, you'll be conducting a phytochemical testing, because that is one of the objectives, okay? You will conduct the phytochemical testing because to, you will gather, so data, you will gather the plant sample, gathering of your plant sample. There's no computation of population because it's experimental. There's no respondents there. But there is a plant sample that you're going to collect. Now, during the collection of plant sample, you don't just say there that the plant sample is collected between 8 and 9 or between 7 to 9 a.m. What's the reason why you place that the plant sample is collected between 7 to 9? What is the reason of placing there? Why the plant, the leaves are collected or shall be collected? The leaves are collected in the morning or so on and so forth. Or the leaves, why you need really to emphasize the climate, the climate condition. For example, you will say the leaves are the leaves of the plant sample shall be collected between 7 a.m. to 9 a.m. because this is the time where the vegetative properties of the plant are active. So you would provide reasons why. Don't just say there that it shall be collected between 7 to 9. Give reasons why the collection is of that plant sample is should be in the morning, why should be air dried, things like that. You have to make some justification that you will be clearly you would be there is a deep meaning or there is a deep understanding of what you will be doing. Once you know the reasons, the justification of observing this protocol. Okay, so that is for your experimental. Then you will have the inclusion in the protocol or in the ethics suggestion. The the inclusion and exclusion criteria. What covers your inclusion? Of course, that those are your sub problems. Those are your objectives. What variables you're going to get to measure. So that is your focus. That is your scope. That is the inclusion. And then concentration is part of the inclusion. You have to place there that the researcher is only using 50% concentration or 20% concentration. You have to emphasize because these are the only concentrations that you will be formulating. And then um, for the exclusion criteria, other parts such as leaves, fruits, or uh, bark, roots, they are not included. Okay, you have to mention why they are not included. Example, roots. Are you allowed to use roots? Once you are going to use roots, it can actually kill your plant. So make some justification. I mean, you have to emphasize, no? You have to emphasize those things, no? That is for the inclusion and what is not included, and that is your exclusion, and what are included. So you should uh, know how to have some focus on your study. So that is for inclusion and exclusion criteria that I have read in the recommendations by your ethics board or by the ethics board. So inclusion, exclusion criteria, research procedure, research design, and the statistical analysis. You have to appropriately uh, phrase out what is your statistical tool in the analysis of your data, and why you are using that one. Why you are just using descriptive statistics. For profile, you can just use descriptive statistics. Mean, median, mode, or which part. Okay. For more variables, in the analysis of the mean, you need to get the weighted mean or standard deviation because that will be used in the interpretation. These are some of the variables that needs to be measured, that is part or the formula used to get to measure your variables. So it's like that, no? So you should appropriately check, use statistical tool needed in the interpretation of your data. So after that one, after collecting, so that is for descriptive, experimental collection of plant sample. Okay, after that experimental procedure. So you refer the previous study conducted as your reference in your procedure. Place that in the citation should be placed in the review of the literature, and you should also place that in your experimental, in your procedure. If it is meta synthesis or meta analysis, quantitative meta analysis, you were asked, is it really possible for you to finish this paper? How are you going to answer that one? You were asked that one. You can justify it by providing the procedure that you can finish the paper because of a very specific standard procedure in conducting or in screening the articles that you want to measure, you want to analyze, or you want to evaluate. It's like that, no? So for survey descriptive, uh, if you are asking for the degree, level of level of performance, degree of performance, or degree of the extent of the 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 satisfaction, the extent of customer satisfaction. How are you going to measure that one? There are several. Many are using that the descriptive on survey instrument. It's usually I mean, the Likert scale is used to determine the level or the degree of agreements, the level of satisfaction. So if it talks about degree or level, the Likert scale is the most appropriate, other than the percentage that is for demographic. But for the questions, level, degree, predictors, okay, the predictor should have independent, dependent variables. You will be considering the mean. You will be considering the descriptive statistics, so that you would be able to measure the degree or the level of performance, the degree or extent of agreement, or the degree of agreement, and so on. Basta there are choices, there are selection. There, if it measures the deepness of a certain variable, that is usually for descriptive. Balik-balik ra gyud na siya. Kato, experimental, when you present the table later, I'll be showing you some examples how to present. But going back yet to the conduction, your chapter 3, you cannot provide your chapter 4 if you cannot conduct your chapter 3. If there's no clearance to proceed conducting your study, except for experimental, they were given clearance because there are two clearances for experimental: conduct the study and to proceed to conduct the study. Since also in the meta-analysis, there are, though they all of the study needs ethical approval, since there are studies that are expedited. These are the papers or the type of manuscript that the board would look into the relevance of your paper. Is there a need for exemption? Is it uh, expedited, or expedited, for example, there are vulnerable respondents. So it would take time. It delays your paper if it is expedited and the other one is. But in exempted, you can proceed. But you would be asked for the protocol in the conduction, or especially for experiment. Okay? Do you have questions so far? I will extend time, since we 1 hour is not enough, but we will be meeting instead of every Saturday 1 hour, for 4 Saturdays. There are 4 Saturdays. We will have if 4 Saturdays we'll have 2 hours, and we will meet every other Saturday. So we still have to meet next Saturday. Kay we are already late. I cannot proceed to chapter 4 without discussing first how are you going to conduct your study. So from there, what else? If you are descriptive, okay, survey, you will start the once you are given the clearance, you proceed to the survey. If no revision, it's good, then you can proceed. Notice to proceed, meaning notice to conduct the study. Then after that one, after you will now consider the procedure. There are three phases in conducting your research: preliminary, the actual, and the post conduction. Post conduction. The preliminary are the request letter from the administrator, your consent from your dean, um, uh, the place where you want to conduct the study. Preliminaries, those are the letters and the consents. You'll ask, you will ask first those persons involved for approval of your in the conduct of your study. And the second is the actual conduction of your study, meaning implementing the procedure on how are you going to, if it is descriptive, how are you going to gather your data. So in the protocol of your ethical, you will you will you will write there that it takes 10 minutes or 5 minutes. You will distribute the paper, the instrument, the survey instrument by yourself, or you will hire enumerator. This enumerator is a trained enumerator, trained personnel in distributing, in gathering your data. You could have interview, you could have a survey, um, and other. It's where you will be using the methodology of conducting or gathering your data. Then, as I've said, in the protocol or in the ethical consideration, you will say there that you will write that you inform the respondents to take at least 5 minutes of their time. You would also say if you are given an honorarium or shall we say token like that, you have to emphasize that one when you conduct your the actual conduction of your study, which also be found in your ethical consideration. What are the data that you're going to collect? So it should be in the ethical consideration. What type of data that you will be collecting? Like that, no? You are going to emphasize, you will emphasize the type of the data that you will be collecting. So after the, that is for descriptive, no? That is for descriptive. You will distribute to how many respondents? Like 35 respondents. It is based from the sample size of the computation of your population. Example 330. So be consistent of your figure. Then if it's instrumental, if it's experimental, how would you conduct the study? You will just need the figure, the observance. For example, the observance, the enzymes. You will compare the standard using the standard and your plant sample. So like that, no? Then what else? If it is metasynthesis, how would you screen your articles? There are 500 articles. Following the inclusion and exclusion criteria, from 500, it reduces to 300. Why? from 300, it reduces to blah, 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 blah. Follow that schematic diagram on the standard of screening the articles for analysis, for meta analysis. Okay? So, if it is descriptive, it is survey, you will use survey instrument. If it is meta synthesis or meta analysis, you will be using a standard Cochrane or whatever Prisma. Follow the Prisma, and then follow the schematic flow of your paper in the screening of the articles. If it is an experimental, you have several experimental. If you'll be using the microorganism during the actual conduction of the study, provide all the procedures from collection of plant sample. So in the procedure, you will have the extraction, the purification process or extraction. Whether you use the extraction, you will use the decoction. You have to emphasize that decoction is used in getting or you use the rotavap to get the pure or the extract. How did you do the process of extraction? Provide the process of extraction. You provide that procedure. After getting the extraction process, the first sub problem is to determine the phytochemical constituents of your plant sample. Chemical screening. Prepare all the reagents. Prepare a table for the result of that phytochemical testing. What are the phytochemical active constituents you will be testing? Alkaloids, tannins, saponins, glycosides, alcohols, uh, terpenoids, and other metabolites. Then you have prepare a table for so that you can from time to time you can what what are your indicators that your the test result is positive. You provide the possible or the expected outcome result, the expected outcome result and the actual outcome result of your experiment. If it is, if you'll be checking the active constituent on uh, sugar using Benedict's test, so the color is brick red, that is the expected result. The actual result, you only get orange precipitate. Then you will have a remarks if it is it negative or the degree of the precipitate form in terms of its heaviness. So you will write their remarks. That is a qualitative analysis of your data. Of course, you will not analyze yet. You have to get the positive, the actual result. You get first the actual result. That is the presentation of your data. You're using that one, you're using these reagents, then the actual result is like this. Then another table is for the uh, analysis of your data where it provides the qualitative observation of your result. So Benedict's test for sugar, brick red. But in the first table, you just provide the data yet. Uh, what is the concentration you place, I mean the procedure in testing the procedure in testing your um, active constituents. You place that in matrix form. What are the reagents? How many drops? So what is the result? The result is orange. So that is your data. Data, that is data presentation. Data analysis, you will already provide the expected outcomes other than your actual result. There is already the expected outcomes. That is the data analysis. And another column is your the indicators. Well, indicators whether you have positive result or negative result, and so on and so forth. So that is if you are conducting the phytochemical testing. Another sub-problem there is the concentration use. How are you going to formulate the concentration? You should have the procedure in formulating your concentration. You have to base it from the previous study conducted, but not specifically following. For example, if the concentration used there is 25, there is an effect in a 25% concentration in the previous study conducted. You go beyond, like the 50% and the like 50% concentration or 10% concentration beyond the 25% concentration that is the result of the previous study conducted, but the same procedure. So provide the procedure. So that is for the concentration in terms of the formulation of concentration. How are you going to formulate the concentration? Preparation of extract first is phytochemical testing or phytochemical screening. The second table is about the another item for that experimental procedure is formulation. I mean, ay mag-una di siya mag-start of collection, extraction, phytochemical testing. You arrange according to your sub problems. Then after the formulation, the extract concentration, how are you going to take the concentration? Then in the next sub ask now the effect of the extract to that microorganism. Okay, what is the effect of that extract to that bacteria? Provide how you culture the bacteria, how you prepare the bacteria, how are you going to conduct the assay, then the possible result of that assay. How many discs or plates are you using? You whatever objectives or sub problems, whatever asked in the sub problems should be provided with a procedure. Follow your sub problems. Check on the procedure. If it has a procedure in the actual conduction of the study, you jive, you align the procedures that are needed based from your sub problem. Are you following? Are you following? So be sure that
Yes, though.
your table should have a procedure. Okay, very good. Should have a procedure. In the actual, where are you going to place that? The actual conduction of the study. And in data analysis, when you, in your statistical treatment of data, when you answer the hypothesis, whether it is a descriptive or uh, experimental, there should have a portion there, um, in that is in the post conduction of your study. How did you collect? How did you retrieve the data? How did you retrieve the data? How many days? How did you how did you s- uh, how did you organize or arrange the raw data? How did you tally, or how are you going to tally your result? You have to use an Excel to tabulate your result. Okay, so that is for the actual post conduction of study. Then after that is the data analysis. So discuss what statistical tools are used and why you use that statistical tools to interpret and analyze your data. That is how you're going to conduct your your chapter 3. So you are now ready for your chapter 3. So I have clearly described it. I will show you some sample, although this is descriptive. I will present other shall we say yeah, I will present other example on the presentation of your data. I will check this is presentan ang then also then ang screen. Okay. So this is an example of a study. I will show you the ethical, the chapter 3, how the chapter 3 is framed. Okay, so this is the ethical consideration. This portion here is the ethical consideration. This is the ari sa ko sa ethical ha kay mo man ang inyong kuan ron. Okay. Wala na tao. This one, no? This is the ethical consideration. Correct me if I'm wrong if we have the same, because this is taken from the National Ethics Board. Respect for person, Beneficence. These are the terms that is or that are taken into consideration for ethical. Beneficence, justice, transparency, risk benefit assessment, benefits. You will say it is guaranteed that this research undertaking can benefit the school, health, teacher, and so on and so forth. You have to go back with your significance of the study. Okay, school heads like that. Going to relate the risk, for example, in terms of confidentiality of the data of your paper, how are you going to minimize the risk, and so on and so forth. In physical harm, in performing the experiment. So these are the context or the content. Content comprehension, documentation of informed consent. So these are found in the form, ethical consideration form. I do hope you were able to get it. So that's it for the ethical consideration. That is for chapter 3. No? Then for chapter 4, this is how you will be conducting the study. By the way, were you able to see the now? Is it visible?
Yes, Doc.
Low? Okay. So
Yes, Doc.
presentation, analysis, and interpretation of data. Example, these are examples, although this is for descriptive. Why this is table 2? Because the table 1, there is table 1 prior to this table. So how are you going to present? Present the table. Table 1 is the presentation of the data on the context evaluation according to the study, no, of technology-based learning as to goals and objectives of the learning design. This one is aligned to the first sub problem in the chapter 1. So this is table 2. This is not table 2. When you write the table, so when you write the table in italics form, this one should be in italics form, and also this one. Below the table is the label. So whatever is that the label or the title, you have to place that before the table. So this is an interpretation of the data. This is already an interpretation. When we talk of interpretation, meaning there is there is statistics in the table. There is statistics. So these are the evaluation indicators. So meaning the items that you need to measure or the variables. So you would be placing here. And if it is a data, it's in Likert scale. If it is a data, presentation of data, this one is already a interpretation of data. If it is a presentation of data, I will check here. It's in Likert scale. It is appended. It's found in the appendix. It's append. It's being appended. The the raw data. By the way, the raw data is actually appended. So in the appendices, the raw data are appended here. Especially in this one. So this is the survey instrument. So these are the evaluation or these are the indicators, the variables. Then the rating scale is the Likert scale. How would you rate the aim of the school? Is it suitable or not? Uh, the very much suitable. These are the legion, no, interpretation for the scale 5, 4, 3, 2, 1. 5 very much suitable, very suitable, moderately suitable, less suitable, not suitable. That is when you have it, this is what you will present there is the summary. This one is you will have the tally, how many you will have an Excel form. You will tally here what first respondent in the first column are the respondents. Then the second, I mean the next opposite to that column are the rating scale. So the first respondent respondent, respondent one in the Excel, you're going to place there, and then the ratings, and so on and so forth. Now that's how you are going to tally the result of your mag-Excel sa ka kung sa nimo ang so that you can calculate the mean, median, or the mean scores which we'll be using in the one. But if just a percentage, checking lang checking, that is percentage. Check mark. So how are you going to analyze the data? It's just in percentage or this. It's not in descriptive statistics. This one rating scale, can't use it. So can this is used to the mean, the weighted mean is used here. Weighted mean. That weighted mean, as I've said, is used in the calculation of standard deviation for the interpretation and analysis of your data. So when you present your data, it should be in table if it is descriptive or experimental. And then the table is series, the number is series. Table 1, table 2, table 3, table 4, for a while. Okay, this one. You can see that this is table 8. You can see that the table is presented. Table 8 is a presentation with data on the process evaluation. But then the raw data is appended in the appendix. Then this is the mean score. You can see here the analysis of the data. The mean score, that one, the mean score is based from the raw data presented in Excel. So the total is for this one 4.3. You have there the standard deviation. So interpretation is very mean is used so that you can get the standard deviation and you can interpret the data. If significant, if you will be interpreting the data using a certain statistical tool, on the satisfaction here is on the satisfaction. This one you can see. Then interpreted as strongly agree, and so on. That one. Then after the data is interpreted, you are going to discuss. The discussion should discuss what is in the table. But not all of the data in the table is discussed. Only those significant data like top 5. If there are many, you can just have top 5 uh, that is top 5 and lowest 5 or top 3 lowest 3. You will not repeatedly discuss what is in the table because it is presented here. It is presented already. The data is already presented. No need for you to repeatedly um, discuss below, like this one. Very often, do not discuss that anymore. This is the percentage. The rank is rank in terms of percentage. So there are several ways where you can interpret your data. This is a tabular form interpretation. Now, there is also the qualitative portion. So that's it. Now you can see the series of number table. Then you have also here the representation of table with that data in the table. But the raw data are appended. Like you have to use the Lec the Excel to tabulate the result of your data. And after that, you will discuss. Discuss in the syllabus, you have there discuss what is the insight, what is the implication, what supported literature. Like for example, this one, the findings of Vish, uh, Vishnu et al. 2022 suggests that blah blah blah. So this citation here refers to what is discussed in the table. It supports that the result of this study, I mean that previous study supported that it has the same findings of this current study. Okay? So there is so after giving the supporting the findings of the study, oh, these are the citations revealed that the students were competent on the online learning competence and had outstanding academic performance. This citation is a support that it has the same findings as the table presented. After that, the researcher, you will discuss further. You will give your insight why the result is like this, why the result is like that, why the result is, why it does not support your result, why your result does not support in the previous study, and so on and so forth. That is true to descriptive, experimental, or qualitative. It should be discussed. The data is presented, interpret, analyze, interpreted, provide discussion, that is by giving insights, implications, and give the citation as the support as to support or a support to your study. So that's it, no? That's how are you going to uh, present your data. Uh, in the future, once you are done in the presentation of your, once you are done collecting or conducting your chapter 3, I would be requiring you to do a mock presentation of table. Okay? Mock presentation of table. Even if you are not yet done gathering your data, mock. You can just have an estimated result, no? Or you could just give, you can use any, even the members of the group, you can use the members of the group so that you can generate a data so that you can make your mock presentation of data analysis and interpretation. I will discuss further on the data analysis, on how are you going to make that mock presentation of data. Again, you have that instrument. So, assuming, let's just assume that you are now in the conduction of your study. Just assume that you are now in the conduction of your study. of your study. So prepare a table, prepare a matrix, because it is still a raw data. Use the Excel form for survey, um, descriptive survey. Prepare a matrix or the Excel to gather your data. Um, Respondent 1, respondent 2. In the first column are the name of the respondents. Respondents, respondent 1, 2, 3, 4, 5. Then the second column are the indicators. The indicators should be placed as headings. No? You will place the indicators as headings, and then the number, the ratings in terms of ratings. For example, respondent 1, about the indicator 1. Unsay gibutan niya diha? 5, 4, 3, 2, 1. And so on. Respondent 2, indicator 1 or statement 1 or variable 1. The variables, there are 5 variables for example, uh, customer satisfaction, no? The level of customer satisfaction. There are variables under that level of satisfaction. For example, the first variable is related to communication skills, so place the communication skill. Then the second column is the efficiency, efficiency in dispensing, that is the second column. So until all the variables are provided in that column, then the first respondent there, what are the answers of the first respondent? You make a tally, 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 and tally. So for the first respondent, pila ka buok nag-tell about, para makakuha ka sa mean. How many are saying that it is the customer for communication skills? How many respondents are saying 5? How many respondents are saying 4? How many respondents are saying 3? And so on and so forth. That is your presentation of, or that is collection of your data, and then you place that in Excel for the survey descriptive. If it is experimental, okay, you will have your table as I've discussed a while ago, the table about the phytochemical testing, the concentration. So you will have a table 1 for phytochemical testing, table 2 for the formulation, 2 variables, positive control, or 4, positive control, negative control, um, experimental group, okay? Positive control, negative control, experimental group. For example, 3. So 3 columns. How many concentrations? 4 concentrations. 100%, 75, 50, and 25. So when you have the treatment, what are the results in concentration if in terms of the microorganism? So the microorganism that you use or the bacteria, for the positive control, what's the result? So you're going to provide a raw data yet before you can analyze and interpret the data. So we will start for the mock presentation of data so that you will know how to analyze using mean. I think everyone would also be using mean. I think both except Katav will be using also table or matrix. That variable should be provided there. So we will try to practice. You are going to practice how to input the data in the table, how is the data is analyzed, and how is the data be interpreted. That is your next semifinal requirements. And I will have midterm exam. Uh, when will be your midterm exam? 18? Was it the first 17? 1 week, 17, 18, 19, 20? I think na may Holy Week karon. Check on that. So I will just, I mean, the admin will post the exam. But definitely I will give the midterm exam based from chapters 1 to 3 and protocol requirements. So prelim requirements and midterm requirements are the coverage of the exam. I would now entertain questions. Do you have questions? What are your questions? Any questions? I am ready to answer your questions. So inform me when I will set the final submission. I think Michelle set the schedule due on March 23, right? Nakidungan na lang sad ko ana. March 23, dugay-dugay pa man na siya. Be sure kay kasi di na ko maka-entertain ninyo ba. Maghimo pa ko og midterm grade. Prelim grade na naman mo yung prelim grade. Ay insim siguro yung prelim. Any questions? You can have your questions. If you have no questions, let's have a photo shooting. We'll have a picture, video cam. Mr. Ray, can you open your video cam for our you may open your camera for photo session. Yes. Are you just using the phone? Anybody who can anybody? Reyes. Can you do the photo shooting, Mr. Reyes?
Dili na makita tanan dok sa akong friend. Dili makita tanan.
Sige lang, just proof we have a meeting. It's okay.
Okay pa dok. Dana po, dok.
Dana?
Yes, dok.
Okay, thank you and good afternoon. Let's communicate in the group chat. Okay, thank you all. God bless.
Thank you,
Happy
Doc.
Saturday.
Thank you, Doc.
Bye, Doc.
you,
Thank you, Doc.
Thank you,
God
Doc.
bless.
Thank you,
Bye-bye.
Doc.
Okay.